Hello everyone, this is Alicia and welcome to AceOSCE's video for the day. Today I just wanted to go through the pharmacy management question that I posted in the group today, and it seemed like everybody had different answers for it. I wanted to break down the question so I can show you how we should be looking at questions, and I wanted to go through all the options as well so I can tell you why one option was better than the other, and just to let you know that you have to check or pick the best option. This is a pharmacy management question. Which of the following have shown to increase adherence to a complex medication regimen for old patients? Now, there are three parts to this question that you have to concentrate on. First, you have to understand the question. The question is asking you how we can increase adherence, which means how can we make it easier for patients to remember to take their medications. That's the first thing, or understand what the question is asking you. The format or the other things that the question gives you is when a patient is having complex medication regimens. This usually means that patient is not just taking one or two medications, but they're taking multiple medications, usually 5 or more medications. That is when they say it's a complex medication. So usually 3 to 5 or higher is a complex medication regimen. And old patients. The reason I wrote old patients in this question was just to make it easier for you guys to understand. But maybe PEBC will not write old patients. Maybe they just write for a regular patient, how do you increase adherence to a complex medication regimen? Old patients was just a little bit of an indication to give you a hint that usually it is older patients who either forget to take their multiple medications in a day, they forget taking one of their medications but do remember to take the other. So we do want to make sure that people of all ages are taking all their medications at the right time and not skipping doses for any reason. How do we do that was the question. Now, the first option that I gave was combination tablets. Combination tablets are tablets that don't only have one medication in them, but have multiple medications. For example, ramipril hydrochlorothiazide or perindopril indapamide. So these are going to be medications that have two medications in the same tablet. Usually it's blood pressure and diabetic medications that you can see in combination. Now, the reason why this wasn't a good option was because not always can we combine two medications. For example, we don't really see any medications that have one blood pressure medication and one cholesterol medication. I know there are some new medications coming out that do actually have both of those in it, but not usually. We don't usually see them very often. And they're very selective medications that have shown to be okay being taken together in terms of pharmacokinetic properties, in terms of chemical properties. And there are always medications like Synthroid and Risedronate that cannot be given together at all with any other medication. Therefore, point A probably isn't the best option. Point C said asking them to take all medications once a day. So it's almost like telling a patient that, okay, fine, you take 10 tablets in a day, you take one medication for blood pressure, one for diabetes, one for cholesterol, blah, blah, blah. So 10 tablets a day, okay, go ahead and take all of them together. We all know that there are drug interactions, especially with multivitamins, calcium, magnesium, that can bind with other prescription medications to decrease their effect. So probably this wouldn't be a feasible or a good option either. The last option that I gave was asking a patient to hire a caregiver to better adhere to prescribed medication regimen. So here you're just telling the patient to add another cost to their daily living costs and depend on another person to give them the medications on time. Now, if they already have a caregiver like a wife or a son who's doing it, it is perfectly fine. It is actually a very good thing as well. But in some or in most cases, you'll see that they're either in long-term care homes where they do not have somebody taking care of them in a one-to-one care setting. So it is really hard to give this option to them either, because you're not going to pay for their caregiver. So it's going to be hard for them to accommodate that. The best option, according to me, was option number B. Again, in some cases, option A can be a good option where there's just a couple of medications. But here we have to choose the best option and read the question nicely to see it's a complex medication regimen. For those of you who don't know, pharmacies in Canada give compliance packages or blister packages on a weekly basis to patients who take a complex medication regimen or more than 3 to 5 medications per day. It is a little blister pack which has medications for 7 days a week, and you can give up to 4 slots per day. So morning, afternoon, evening, and night. So you can distribute the medications in a blister where you can actually tell the patient that you have to take these 2 tablets in the morning, this in the afternoon, this in the evening, and this at night. This gives you more flexibility to time the medications, especially when you're giving a patient Synthroid or Rezadronate that has to be given in the morning without other medications. And it kind of gives a little list to the patient to see which medications they have skipped or which medications they did not take for a week or a day. So this gives them more clarity and more flexibility. I will try to include a small picture of a blister pack after this slide so you guys can see what it looks like. I just wanted to give the answer to you guys, and if you have any questions, feel free to reach out to me. Here's the picture of a blister. So this is a blister pack or a compliance pack, where on the left you have a list of all the medications, and on the right you have all the medications per day and 4 slots of a day.